Okay, we're all set. Welcome, everyone. I'm Holly Jimison. I'm faculty in both health sciences and computer science. And we are thrilled today to have Donald Martin Jr. from Google kick off our new Department of Health Sciences speaker series featuring innovators in health equity and racial justice. Today's talk is also part of Corey College of Computer Sciences Tech for Impact series. Now, Donald Martin Jr. is Senior Staff Technical Program Manager and Social Impact Technology Strategist at Google. And I've been a fan of his work ever since I heard him talk on a panel at Stanford. Donald's work focuses on driving innovation in the spaces where Google's products and services intersect with society, as well as understanding the intersections between trust and safety, machine learning, fairness, and ethical artificial intelligence. He holds a Bachelor of Science in Electrical Engineering from the University of Colorado at Denver and founded its National Society of Black Engineers chapter. Donald has over 30 years of technology leadership experience in telecommunications and information technology industries. He's held CIO, CTO, COO, VP of IT, many positions in global software development companies and telecommunications service providers. Donald holds a US patent for problem-solving modeling and resource optimization. His most recent publication is the Harvard Business Review with an article entitled AI Engineers Need to Think Beyond Engineering. Donald's work is certainly impactful and will be interesting to hear today about designing equitable technology and ethical AI from an industry perspective. So before we get started, I want to acknowledge the group here. We do have a wonderful turnout. I'm looking at 125 participants right now. We will be recording this session and plan on making it available for classroom use in the future. But because of the large size of this group, we're asking you to mute yourselves, turn off your cameras until we reach the discussion period. We've left lots of room for discussion, but meanwhile, please do put your questions for Donald in the chat window and we'll call on you at the end. At that point, turn on your camera and unmute yourself. Now we do have a mix of students and faculty here, and I want to make sure students don't be shy about questions. Please join in. Okay, we are ready to get started and hear about driving equitable innovation in health and technology. Welcome, Donald.
Thank you, Holly. Thanks for that great introduction. And thank you for giving me the opportunity to be the inaugural speaker at for this really important series. So let me share my screen and get started. Hopefully everybody can see that. Can you give me a thumbs up, Holly? You see that?
Yes.
Excellent. Hello, everyone. I'm going to be talking about how to leverage community-based system dynamics to combat AI bias in high-stakes domains, like healthcare, for example. I'm going to speak for about 25 minutes, between 25 and 30 minutes. We should have plenty of time for Q&A, which is always the most exciting part of doing this type of work. Let me click on this to make sure I can transition. The outline for this talk is going to be, first I'm going to provide a little background for what's happening in the technology industry right now with respect to AI and AI bias. I'm going to cover the importance of contextual understanding to be able to combat AI bias and how the communities that are working on trying to do that emphasize that point. And then I'm going to dive into a brief case study about the root cause of racial bias in a medical algorithm, which really goes along with our theme today. And then finally, I'm going to go into a little bit of solution exploration and talk about some of the ideas we have about upgrading the product development process to leverage community-based system dynamics in order to combat AI bias. So let's get started. So right now, we're going through what a lot of people in tech call the fourth industrial revolution. The previous industrial revolution was about automation and information technology. This one is about genome editing, robotics, 3D printing, quantum computing, and of course, artificial intelligence, which is the premier technology of this particular industrial revolution. So I want to give a little brief introduction on what machine learning and AI are, just to get people familiar with some of the terms that I'm going to be using. So when people talk about AI, the main product of building AI or doing machine learning is a model. And this model has multiple names. People call it the algorithm. They also call it the black box, because in many cases, we don't understand how the model makes its decision. And the main reason we build these models is so that it can automate tasks like making predictions, making recommendations, classifying things, for example, classifying things in photographs. Now, these models are built within a particular context. They are built within typically the context of a product development team that consists of product managers, software engineers, data scientists, analysts, and other roles. And these folks are making critical decisions that impact how that model ends up performing. Now, in order for the model to make these predictions, it needs to be trained. So a key aspect of this kind of work is training the model. And in order to train the model, you have to provide it with data, with observations that are relevant to what it is that you want it to predict. So data is a key component of this. So you have to ask, in that case, where does this data come from? That'll be what we talk about in just a second. Now, in order to finish training your model, you have to evaluate it. And so the model will be learning, it'll make some predictions, and you evaluate whether the model is accurate enough for whatever the particular task is that you're talking about. Now, since data is driving this whole pipeline, it's really important to understand where the data is coming from. And at a high level, the data is coming from society. Society generates large data sets. We call it big data. And a key thing to understand is that this source of these inputs to this pipeline is inherently biased, right? Because society has things like racism, gender discrimination, ableism, wealth inequities. Those are all based on inherent biases that exist in society. Now, since society generates this data, it's also called the data generating process. So the statisticians in the room will recognize that phrase, the data generating process. Now, so as we can imagine, you train this model with data. One other thing I want to mention. So I talked about how we call the model the black box because we don't really understand how it makes its decisions. I also think of society, which is generating all this data, as the other black box because we don't really understand how society works either, right? It's very opaque when it comes down to understanding why things happen. So it's the other black box in this open system. So eventually you get to the point where you've trained the model, you've evaluated it, you're satisfied with how it's predicting or doing the task you've asked it to do. You release it into society. And of course, releasing that model into society is going to result in a feedback loop back into society, which is then going to generate new data based on what this new thing that you've added to the world is adding to it. So it's really important how these models perform and what sort of outcomes they generate. So this is when we talk about like where AI bias comes from. And it comes from the fact that the data driving this whole pipeline is coming from society, which is inherently biased. So of course, the outputs of these algorithms are necessarily going to have bias in them. And so this is where this phrase of algorithmic bias comes from. And this is a big deal, right? So, and one of the reasons it's a big deal is because the context in which these models are created often lack diverse perspectives that can help you combat that bias, that can help you interpret what society is delivering with respect to these data sets. If you don't have experience with these inequities, it's going to be hard for you to identify issues with data and with training methods. So key sources of bias: one, inherently biased society; the other, the fact that there aren't many diverse perspectives actually working on building these models. So there are a lot of blind spots in being able to prevent AI bias. And as I was saying, this is a big deal. You probably can't go, every day you will see a headline somewhere in the world about AI bias and AI bias outcome. And so this is a critical thing that has to be solved and dealt with in order for us to ever reach a point where we have trusted, robust AI at scale in society. Now, for those who aren't familiar, there are really very specific examples of these algorithms being biased, particularly against Black, Indigenous, and people of color. And that's due to historical and structural inequities that exist in society. So these groups tend to be the most vulnerable to AI bias. One of the most prominent examples of this is bias in facial recognition algorithms. And it's a documented fact that these algorithms work worse on African Americans and Asian faces, for example. And when you have this situation, it leads to real harm, serious harms that actually deny people their freedom, their liberty. This is an example where a facial recognition algorithm identified the wrong person as the perpetrator for a crime, and that person was actually arrested. And so the stakes are really high. And these biases are being propagated now, and they're causing harm right now. This isn't something that's going to happen in the future. It's happening now because our algorithms tend to amplify historical biases that already exist in society. This is another example, again, from the criminal justice system domain. In this case, this is not a facial recognition algorithm. It's a risk prediction algorithm used in the criminal justice system in the US widely. And this is used to decide whether or not someone should be given bail, how much their bail should be, what their sentence should be. And it's a proven fact that these algorithms tend to be racially biased against African Americans in the US context. So since this is such a huge issue and a danger for society and humans, and it's going to impact industry, right? People don't want to use and support technologies that harm people. This has to be addressed. And so over the past few years, there have been specific conferences dedicated to fairness, accountability, and transparency of these systems. This includes writing papers, critiquing, proposing solutions, and this aspect of industry has been growing. This particular conference, which is the premier conference, and it's the community I'm part of, has grown nearly 3x in 3 years. And the amount of research papers that are written on these topics has grown 4.5x. Now, I mentioned that this community because this community for a while has been talking about the importance of understanding the context in which these algorithms are developed and where they're going to be deployed as being key to mitigating AI bias. So I want to dive into a couple of quotes from this community, and then we'll dive into a very specific example to get more specific about what we mean by context. So this first quote is from a woman named Christiane Loom, who's one of the leaders in this community. And her quote is, "How can we declare a model fair," which is one of the key things you want to do when you're evaluating these models, "without understanding the broader context within which the model is going to operate?" So it means if we don't really understand the context of the criminal justice system and how people are treated within it, when we deploy this model, there's no way we're going to be able to evaluate it for fairness before we roll it out. This is a major issue. Another quote in a similar vein, this is from the AI Now Institute, says that producing technologies that work within complex social realities and existing systems requires understanding social, legal, and ethical context. Now, the interesting about this one is it doesn't call it AI, it says producing technologies, right? So these issues that we're having with AI have just kind of amplified this particular issue that has existed for decades, right? This is something that is inherent to producing technologies. When you don't understand these complex realities, you end up amplifying existing inequities. Now, to drive this home, I'm going to focus on a specific instance of racial bias that was identified in a widely used medical algorithm about 2 years ago, October 2019. Now, the purpose of the system that this algorithm was a part of was to identify patients with the most complex healthcare needs so they could be given access to special programs. And the goal was to reduce the overall cost in the healthcare system. That's important. The goal wasn't necessarily to improve health outcomes, it was to reduce the costs. Unfortunately, it turned out that people not selected for these special programs by this algorithm suffered from nearly 50,000 more chronic diseases than the people that were selected. So it didn't do the job correctly. And the people not selected were disproportionately Black Americans. This is why this algorithm was deemed to be racially biased. So why did this happen? The researchers who studied this algorithm and how it was created had unprecedented access to the whole pipeline, exactly what data was used to train it, what methods were used to evaluate it. And this is rare because oftentimes when people are building these systems, it's proprietary how they do these things. But they had unprecedented access, and they identified that the root cause of this failure was something called target variable selection. This is when you decide out of these data sets that you're analyzing, decide which particular factors you want to use to make your prediction or make your choice. And this happens during a phase of product development and AI development called problem formulation. And so I'm going to dig into detail a little bit in terms of like this end-to-end process. You guys got a preview of this middle gray area. And I'm going to talk about the two sub-processes at the end of this, and then I'm going to talk about the problem understanding and formulation piece last. But that is where the root cause of this particular failure was. Now, the ML system design and development phase is the phase that people typically focus on the most right now when they're trying to mitigate AI bias. They focus on trying to improve things in terms of data selection and collection, trying to improve things in terms of what architectures are selected and how they're designed, and they focus on evaluating the model training processes. The last phase is when you actually decide, hey, I've evaluated this, I think it's performing well. Now I'm going to test this product with some subset of the world, some subset of the market that I'm targeting for this, and then ultimately I'm going to release it into the world and measure the impact. Now the key thing about these phases, you'll see these sentences I have above each of these phases. These are all the critical decisions that are made by humans during this process. So human decision making is a core to every step of this, and it's always an opportunity for more bias to enter. Now I want to focus on this, the very beginning of this process, the process, the section labeled problem understanding and formulation. You'll see what happens in the beginning of this process is people are making choices like, what are we going to fund? Why are we going to fund it? Is this going to help us, be profitable, gain market share, et cetera? And then another key phase is product conception and design. Now, actually understanding the problem formulated for ML is often an ad hoc process. It's an informal process. So there's not very many concrete principles or practices for that particular part of this process. So, but these happen to be high stakes decisions. Let's just look at them in a little bit more detail. So these may seem innocuous, but deciding what problem you should solve and what the relevant factors of that problem turn out to be high stakes decisions because they lead to you choosing which variables you're going to try to get your model to predict. Deciding who the target users of your technology is also who they are is also a high stakes decision, and deciding what you think their needs are is also a high stakes decision. Deciding how you're going to measure success is another one. And so since this whole process is driven by human decision making, we delved a little bit into how humans make decisions. And there's been some compelling research in this space. This is a quote from a paper by Tenenbaum and Griffiths that talks about human decision making. And when we make decisions, we use our causal inference capabilities, our own ability to predict the future and imagine what might happen. And it's a key part of human decision making. But when we make these causal inferences, it turns out that they're shaped by strong top-down prior knowledge that we have. And this top-down knowledge are types of theories. They're intuitive theories about how the world works, and they're critical to decision making. We call these causal theories in the work that we've done because of this linkage between causal inference and intuitive theories. And these causal theories are what we use to interpret complex realities, right? We all have our own causal theories. We filter reality based on them, and we use those filtered realities to make decisions. And as you can imagine, these causal theories are where our biases are, right? These learned biases over time. Now let's take a look at what role these causal theories played in the failure of the medical algorithm. Now, just to restate, the machine learning problem that the product managers and engineers were tasked with was to select patients with the most complex healthcare needs for special programs. It turns out, even if you have a lot of data, figuring out who has the most complex healthcare need is a really complex causal modeling problem. And so oftentimes people want to avoid that. So they simplify. And so they develop a causal theory. And oftentimes this causal theory is implicit. Oftentimes it's not made explicit. In this particular case, the researchers studied that the causal theory that the designers of this system formed was that, hey, if someone has more complex healthcare needs, then that should have increased how much they spent on healthcare in the past. And based on this simple causal theory, they chose spending on healthcare as their target variable to determine who has the most complex healthcare needs. So I'm sure there are people that are listening to this right now. They're like, I can see how this is problematic. Unfortunately, the designers didn't see this at the time, and we're going to talk about why. But this choice is problematic. And the reason it's problematic is because this causal theory excludes critical factors that impact how much Black Americans spend on healthcare independent of their healthcare needs. These are factors like underdiagnosis due to bias, lack of trust in the healthcare system, wealth and income disparities, and lack of access to affordable healthcare. These all actually decrease how much Black Americans spend on healthcare independent of how serious their need is. Now, taken together, these factors represent a subset of the healthcare system structural inequities that exist in the US. And it just so happens that these same structural inequities actually increase the complex healthcare needs that exist in the Black American community. And this fact has been borne out by COVID, right? There's no doubt about this, and it's been illustrated clearly. And so as you can see, this updated causal theory that includes additional factors and their impact on spending on healthcare is much more complete and robust than the causal theory that drove the design of this AI system. And this is why it ended up being racially biased. So choosing that target variable spending on healthcare is also called choosing a proxy, right? Spending on healthcare in this case is a proxy for complex healthcare needs. And when you have incomplete causal theories like the one that drove this design, it can lead to problematic proxy choices, actually harmful proxy choices. So just imagine these folks that didn't get access to this program, they had 50,000 more chronic diseases. I'm sure this resulted in death, loss of income, all sorts of things that people that studied this didn't even quantify. Now, we talked about context. So the way we think about context, we think core to context are these causal theories that humans walk through the world with about how the world works. And it's critical to the decision-making that drives the dynamics of society. Now, I've made this a more complete causal theory, right? Including these other factors. But an important thing to understand is that even this more complete causal theory is still seriously oversimplifies the amount of detail you need to go to understand societal context because they are dynamic and complex. Specifically, they're dynamically complex systems that are constantly changing in nonlinear ways due to inherent time delays in these kinds of systems. So you can imagine the lack of trust in the healthcare system didn't instantly happen, right? It built up over time. And then there are feedback loops between the factors. And so if you're going to tackle understanding societal context to develop more complete causal theories, you have to tackle the fact that these are dynamically complex systems. And then you also have to tackle the fact that the people that are going to be impacted by these systems need to be part of forming the causal theories in the first place, right? And that's a key aspect of what we're going to talk about in a second. The communities that are disproportionately impacted by algorithmic bias need to be part of the very early stage of developing these systems and participate in formulating the causal theory that's going to drive the design of the system. So that particular point is what we try to get across in a couple of papers that we wrote, and these papers are the basis of what I'm presenting today. The first paper is called Extending the Machine Learning Abstraction Boundary, a complex system approach to incorporate societal context. So here we actually define in detail what societal context is based on complex adaptive systems theory. And then the second paper is specifically about the use case I just talked about with the medical algorithm and how to leverage community-based system dynamics to mitigate it. Now, based on that work, the solution that we're recommending within industry is to introduce a formal and explicit problem understanding and formulation subprocess to the traditional product development process. I mentioned this kind of work happens in this early phase of the product development process, but right now it's ad hoc and informal. And when people formulate these causal theories, they're implicit, oftentimes they're not written down, so they can't be examined and tested. And it makes it hard for other people to participate. So our recommendation is to introduce a formal process. And this process needs to be optimized to do a few things. Number one, it needs to be optimized to elicit and synthesize and make explicit the causal theories of target stakeholders. And those target stakeholders include the people that are designing the system, the people they're designing the system for. These are the people that are funding that work. But it also has to include the causal theories of non-target stakeholders. These are people who may not be thought of as part of the market that you're developing this for. But when these systems hit society, they end up impacting all of society. So identifying who the non-target stakeholders are is really critical. Second thing is that during this process, the perspectives of the communities that are most vulnerable to algorithmic bias need to be able to fully participate in causal theory formation. So this process has to be participatory, but it also has to be non-extractive, right? As you can imagine, the companies who are going to need to have this understanding have much more power than the communities that they need to get the understanding for. So we have to work on how to make sure that this exchange of information is mutually beneficial. It can't be an extractive process, otherwise it defeats the purpose and again amplifies injustices and inequities. And then finally, I talked about the fact that the societal contexts where these systems are deployed are dynamically complex. So whatever is used to operationalize this process, whatever is chosen for that, it has to be able to contend with the dynamically complex nature of what it is that we're trying to formulate causal theories about. Now, we've honed in on a practice called community-based system dynamics as a promising way to operationalize this new subprocess that we're proposing, this problem understanding and formulation subprocess, this participatory problem understanding and formulation subprocess. And the reason we've chosen it is because CBSD inherently is a participatory practice for including communities in the process of developing a shared understanding of complex problems. And it specifically does this from a dynamic feedback perspective. So it's built to contend with this dynamically complex nature of societal contexts. And it's also geared to actually build capacity in these communities to be able to describe their problems themselves using these techniques independent of any other organizations. So we need to put the power and the capability in their hands so that they can fully participate as equal partners in any sort of participatory process. CBSD, Community-Based System Dynamics, leverages visual tools and simulation to support this process of co-developing causal theories in explicit and transparent ways. And these visual tools are important because it makes it accessible to people from many backgrounds to participate in formulating these causal theories for these complex domains. And so I'm not going to go through these diagrams in detail. I'm not going to explain all the notation, but just to give you an idea of the formalism and rigor that's used in system dynamics to represent these causal theories. The representation on the left is called a causal loop diagram representation. You can see how it has notation for representing these feedback loops that I talked about, these time delays that I talked about. The representation on the right is a stock and flow representation. These are both qualitative representations, but the stock and flow representation is set up so that you can actually add data and quantification to your model so that you can eventually simulate it. And simulation, the purpose of simulation is to deepen your understanding of the system, these complex systems that you need to understand because they represent the context of where the system is going to be deployed. You need to understand this before you start developing products or designing products to intervene in a particular context. Now, next I'm going to just walk through a few examples of us actually utilizing system dynamics directly within communities to build capacity in communities, be able to use the technique to describe problems for themselves so that they can fully participate in understanding the problems that are driving product development. And so our approach to this, the very first thing we did with this work, even before we wrote the papers, was to go to the Data for Black Lives community, which is a community of data scientists and activists and policymakers who are intently focused on the problem of algorithmic bias and the use of big data and how it can amplify injustices. So we wanted to basically test our ability to teach people these techniques and their ability and develop their capabilities to engage with them in a rigorous, comprehensive way. And this is what it looks like in practice for people to jointly discover and make explicit their causal theories and to work with others to generate shared causal theories. This workshop was about 3 hours. After about an hour, people were fully participating in using this notation to debate and understand each other's perspectives through the notation of causal theories. The sorts of artifacts that you generate are these sorts of informal diagrams that can eventually be turned into software, but you don't necessarily have to do that. The point is for people to be able to be explicit about their respective causal theories and beliefs and attitudes and values about particular problems. Just another example of how this can be informal. You don't need to have a lot of special equipment to do this kind of work. This last slide actually illustrates how, if you want to, you can start to use software to document these causal theories. And this can put you on the path to being able to actually simulate these to get a really deeper understanding of the mechanisms that drive specific problems so that you can use that as a way to even test and plan interventions before you roll them out into the world. Now, the last slide I'm going to show, just to drive home the accessibility of this kind of work, is a slide of this is actually my wife. She went to this conference, and she's as far away as you can imagine from the world of math and science. She trained at Alvin Ailey. She's a professional dancer. She teaches Pilates. She has a nonprofit, but she was able to learn this notation and apply it to her problem domain, which didn't have anything to do with healthcare or the criminal justice system, but just being able to describe complex problems in a rigorous way helps people solve those problems in better ways. Now, last slide, summary and next steps. So to summarize, we think that participatory problem understanding and formulation is going to be an important practice for mitigating AI bias. And we think CBSD is a promising approach for actually operationalizing it. But it's not going to be easy. This is going to be difficult. As you can imagine, this requires, changing the way industry operates. So right now we're in the middle of formulating and planning and starting to execute case studies and pilots to actually test the efficacy of doing this kind of work in a product development context. And the key findings we want to get out of this work is to identify the constraints of practicing this kind of work in a corporate environment. We want to really have a detailed understanding of what these constraints are. These include things like incentive structures, for example. And there are also constraints of doing this work in corporate environments in partnership with communities in ways that are non-extractive and in ways that empower communities and don't extract from them. That's super critical. It's going to be really difficult to figure that out, but we've started the process, and that's what I'm going to be spending a lot of my time on over the next couple of years. So I'm going to stop there, and really interested in jumping into the conversation. Ali, you there? We're gonna switch to Q&A.
Hi, Donald, this is Emily. I don't see, I think Holly might have just gotten kicked off for a moment, but I do have a few questions in the chat that I'm happy to help share to start us off. So I think, one common theme we see is one of your summary steps is if the community that we want to reach is already suspect of the institutions, what's our best approach to get them to participate in CBSD?
So this, of course, this is the toughest question. I don't know the best approach, but I do know that we have to practice patience, and take the time that it takes to build relationships and trust. Without that, this won't work at all. And so that's the number one thing, is to be patient, from my perspective. And that's, as you can imagine, that's a challenge in product development context, because there's a tendency to want to move fast. But it definitely would be a mistake to try to rush into, reaching out to communities, particularly from the interest of the company. Hey, we want you to help us figure out how to do a product. That's not the way to start. It should be, we want to genuinely understand your needs and problems and perspectives, independent of what it is that we're trying to build. I think it has to start from that place, and it has to start with a genuine interest in understanding and solving structural inequities.
Great, thank you. I see Jordan, one of our participants, has his hand raised. So if you want to unmute yourself and ask your question, Jordan, and share your video, that would be great.
Awesome. Thank you very much for the presentation. I enjoyed
Were
it.
Were you at Data for Black Lives? I saw you were.
I've been the
That's
first
awesome.
one volunteer. I loved it. So I appreciate you giving that shout out. I did miss your or the presentation at the last one, but hopefully you'll be at the next one. But I was curious, go back to the slide. I put it in the chat a little earlier, but like when you're talking about how society produces data, I'm a big proponent of like a universal basic income. And when I think about like, just like Facebook and how much money they make off of the data that I produce for free, like, or even just Google, like, what are your thoughts on, or do you see like an opportunity to address like generational historic inequalities with like, I don't know if you're familiar with Stockton, but they had like a universal basic, Stockton in California, they gave out like $500 to people. But I just think about like, I do a lot of quantified self and I track my own data, and it's like, oh, well, if some company wanted to pay me for my data, like I would be happy to do that. But I guess I would want it to be equitable versus like, I will give you $5 or something. So you get your thoughts on universal basic income and or an opportunity to use AI to address some of this past inequality.
I mean, one thing I will say is that I definitely think there's an opportunity as we start to work through, the idea of working with communities to understand problems, that there's an opportunity to, shift a little bit, like the relationship, right, between folks with respect to data, particularly this kind of new class of data. So Data for Black Lives, one of the things they've been talking about is the idea of like data trusts. And also, communities, creating their own data about their own problems and putting that data in a trust. So I think that's, so I'm a proponent of really exploring that idea. I'm not gonna, I don't know much about universal basic income and exactly what its impacts are, so I can't really comment on, pro or con for that. My wife was just telling me about the Stockton, experiment. It makes sense. A lot of people are talking about it. They're also talking about it because there's fears that AI is going to, take away a lot of jobs. And so people think AI can actually contribute to that. That's not an area that I've been doing much focus, but it makes sense to me. But I think the idea of data trust, which Data for Black Lives is pushing, is a powerful one.
Awesome, thank you.
Seth, I see you have your hand raised.
Hi, Donald. Thank you for coming. My name is Seth. I'm a computer science PhD student here. You mentioned we would have fewer issues with these algorithms if we had more diverse people designing them in the first place. And I wonder, what you think the best way for us here, and by us, I mean the comp sci kids, to do about that.
So I think the number one thing is to do some self-reflection. So because your organization's like a little mini society, right? So it's got some structural inequities built into it, right? Because it's part of broader society, right? Which has them. And so it's impossible for them not to feed in. So actually understanding the system that you utilize in order to find candidates for your school, choose people, help make them successful, to get really creative about like self-examination in like a rigorous way. And system dynamics is actually a way that you can use that, right? Actually developing like what's your causal theory about how you find qualified students and make sure they're successful within your system. Like what's your current causal theory about that? And then bring in other people that are far away from your context, that are closer to, that are more proximate to the problems out in the world where these inequities exist, and get their perspective on what your causal theory is, right? And actually formulate, here's a mechanism that we're currently use before you start, that's why I don't like to throw out solutions, right? Unless I actually have some understanding of like, what are some of the details about the existing system, and that at core to those existing systems are kind of beliefs and attitudes, right, that have been around for a long time. And so that's where I would start. There aren't any simple answers to that, but self-examination and looking at structurally how you all are doing things in like a rigorous way.
Wonderful. Crystal, your hand's raised, and then I'll take some of the questions that are in the chat.
Great, thank you, Emily. And thank you, Donald, for that fantastic talk. I am also really interested in bias in medical algorithms, and I'm kind of curious at the level of regulation, what you think can be done in the broader sense by local or federal government to address issues like this.
Yeah, I'm always reticent to talk about regulation and policy, just because we got a whole bunch of people at Google that work on that full time. But I do think a critical element of whatever is done has to address the participatory aspect of developing technology. And because that's often kind of left out. I think the people that are most proximate to the problems in society and that tend to be the most vulnerable need to be fully participating in, not just designing, but even deciding what problems should be worked on, which problems we should be trying to leverage technology to solve. So yeah, sorry not to be able to delve into like too much into the policy work, but that's, I think, a key common element, I think.
Thank you.
Great. So Donald, one question in the chat that we have is, when you bring this participatory approach, you'll have folks with differing views on if healthcare should be a basic human right. And so how does CBSB approach this in talking about healthcare as a human right and the bias that's in the AI system?
Yeah, I mean, so CBSD, so the technique, I was talking about this yesterday at another talk, the technique is actually intended to surface disagreement like this, right? And to reckon with it and make it explicit. It's not going to solve it, but it's a great forum to be able to surface different perspectives associated with like values, because this is kind of like a values-based conversation and debate, and actually making them explicit and making them part of a group developed model of what the key factors are. So you can imagine, just the differing perspectives on whether or not healthcare is a right or not being one of the factors of the societal context that you're trying to understand. The goal is not to get everybody to necessarily agree, but it's to get everybody to basically be able to surface their perspectives and mental models in a safe place, and then represent them as part of the system dynamics that drive society and its outcomes. So CBSD itself is kind of, it's independent of the specific issues, but it is a way to turn disagreement into data that the respective parties can utilize to collaborate on developing a more complete understanding of how they respectively see the world, and to reflect that in a model that has to be contended with if you're going to be introducing any kind of intervention.
Great, thank you. And one actually more logistical question about this framework is, where can folks find out more about it? Are there resources available online for the CBSD framework that is available to the public or to students?
Yeah, there's quite a few resources. Like I would actually, you can just search for community-based system dynamics, but I would actually, if you go to the website that I have, donaldmartinjr.com, you'll see some of the papers that we wrote. And one of the key things to do is to start reading some of those papers and look at the references in those papers. And that'll start to point you to like the best CBSD resources. But if you just do a search, you'll see some of the works. And there's a particular person, the person that invented CBSD, his name is Peter Hovmand. You search for Peter Hovmand and his works, that should lead you to some other interesting links. He actually wrote a book on CBSD that I would recommend people getting access to and reading. There's actually, on the website also, there's a paper that we did in partnership with some folks from Data for Black Lives, specifically on healthcare and AI. That was a follow-up from the Data for Black Lives conference. So we actually did practice CBSD to develop a working causal theory and a working simulation around the availability of data for healthcare decision-making algorithms and how that's impacted by things like lack of trust in the healthcare system.
Thank you. Yeah, and thank you to some of our participants sharing these links and resources in the chat.
Yeah, the community is working well there.
They are. Nirban, do you want to ask your question that you just put in the chat?
Yeah, sorry, I'm just trying to save a little bandwidth so I won't turn on the video. Connected home. So I guess my question is, we're often kind of led astray by this profit imperative, big corporations. It doesn't matter whether in the healthcare field, technology field, that's, all across the board. So how can we ensure that we have the necessary stakeholders at the table from the get-go, just from the design thinking, from the start of, data collection, not even thinking about the algorithm, because there are, a lot of disparities right there just in, data collection cutoffs and, and such. And I guess a follow-up question to that would be, how can we make this equity a greater priority for leadership who actually have the capital, and the thought leadership to drive corporate strategy and the product development down the chain?
Yeah, I think those two questions are related, I think. And so I think so for the first question, I think I kind of try to answer that question in the talk. I think the key is actually trying to get product development folks to focus on problem understanding and formulation more than design. Really having a deep understanding of the problems of the stakeholders that are going to be impacted by the technologies. And this kind of leads to the second part, right, which is we have to get to the point where the people building these technologies in these contexts of profitability, which I don't think those contexts are going to go away anytime soon. But it's to help people understand that they can actually build better products if they are focusing on solving problems that they typically don't realize exist, because they're focusing on building for a majority as opposed to understanding the problems of people that are marginalized in society. So you can end up, if you build with folks that are on the margins, you end up actually building better products for everyone. So that's a core, value sensitive design principle that really hasn't been applied at scale, I don't think. But I think the key to applying that is to move away from focusing on design and move towards focusing on understanding. So this is going to take a lot of work in terms of actually changing cultures and principles that drive the organizations and and changing their perception of where the value is, right? So I don't know if that fully answers your question, but I think it's about one, just driving the connection between better understanding before you intervene with a product is going to lead to better products, better solutions for the people that you're trying to provide product to, because that's part of your value proposition. And so it's a kind of different calculus. Kind of related to this is an interesting article from the Harvard Business Review. It's called "The Era of Move Fast and Break Things is Over." I think this was written like about a year and a half ago, but it's talking about this, the need to have this relationship between this deep understanding of the margins to actually, develop better products, more effective products. And oftentimes the reality is people feel like they can go faster, right, by skipping this understanding step. But after the fact, when you end up with all these kind of things in the press, you end up you actually didn't save any time, but it's hard for people to see that. So I think it's a long process, but those are things that we're working on specifically. But you got to be able to show the relationship between this deeper understanding and better products.
Great, thank you. I just wanted to follow up really quick, and this is like you touched on this, but how does empathy play into this? And I don't know if you have any insights into, what's worked for your team, or how you've sort of framed the thinking around that.
Yeah, I mean, I think it's central. Like, I didn't call that out specifically, but the key to being able to do any of this group model building, collaborative causal theory formation work, I mentioned trust. But I think another key part of that equation is empathy, right? Because there's no way to get people to be explicit about what they actually think is causing something like mass incarceration, unless you build a environment of trust and empathy from the beginning. Otherwise, you can't even discover the knowledge that you're trying to get access to. So I think trust and empathy are central. And I think that's also trust and empathy. So trust and empathy are kind of like values as well, right? And so I was just thinking again about value sensitive design. Again, they're focusing on design, but they are getting at the kind of right aspects of, it's all about understanding the value landscape, right? That's broader than just the value landscape of the majority, the mass market. You have to be able to see the value landscape of the majority and the marginalized in order to have a deeper understanding before you start intervening on something.
Great, thank you so much.
I'll mention one other book. It's called Design Justice, and it's in the same area. There's a great book, I think it's called Value Sensitive Design. Those are two books that I would recommend taking a look at.
Great. So there's some fabulous chat going on, sharing of resources. Just to be mindful of time, we have about 5 more minutes before we hit the 1 o'clock hour here in Boston. So if anyone has a final question for Donald, this has been such a thoughtful and in-depth and innovative conversation, and I really appreciate you kicking off this series and taking your time to speak with our community.
It's been a pleasure. I'm really enjoying every second of it. I'm really curious about who Mr. King is. I see him up there in the corner. I'm just like, is he going to ask a question? I think you're muted, but.
You're on mute.
Yeah, okay, I'm unmuted now. No, I don't have any question at this point. I'm interested in this general topic from a couple of different perspectives. I worked in public health for a number of years as a contractor with CDC, looking at the exposures to hazardous substances and how that affected communities, and particularly communities of color and the poor. I'm currently publishing a newsletter that I have for a couple of years, focusing on increasing science and engineering opportunities and access for communities of color and women. One of the things that we're planning on doing later this year, we issue a newsletter 4 or 5 times a year. Later this year, we have an idea for a call for articles looking at racial biases and inequities dealing with diagnosis of health. This sort of comes out of an earlier newsletter of ours when we looked at how universities and businesses in the tech community were responding to immigration, COVID, and science. And that newsletter is available on our website right now. So you can look at that and see how universities began responding to COVID a year ago as shutdowns were occurring, as faculty was being affected, as students were being affected, as immigration policies were being affected. So later this year, we're going to look at a more in-depth, I guess, a series of articles dealing with health disparities in particular. And again, we haven't issued the call for articles yet, and I was on this call primarily to refine my thinking as to how we might approach it.
Got it.
I appreciate, Donald, your expertise and your analysis. I made a few notes, took a couple screenshots. So
Got it. Got it. Yeah. Thanks for sharing that. Thanks
That's
for
okay.
sharing that, Lloyd. Yeah. We did write one paper. I think they put it in the chat that's specifically associated with the which you talked about, not specifically associated with substances in the communities, but an approach to like understanding bias in technology. So that would you might look at that as the kind of article, whether that's the kind of article you would want people to submit or something that's more qualitative.
Yeah, well, you know, on PBS the other day, there was a repeat of a presentation on AI bias, and I made a lot of notes from that. Joy Balamuni, I don't know, at MIT.
Yeah.
I don't know if I'm doing her name right, but it was a very interesting discussion about AI and its development and how it's being both used and misused.
Yeah, she's a very important leader in this space. Very important.
Sure.
Yeah.
Good to meet you, man.
Same here. Same here.